I will call the Joint Government Oversight, Health and Human Services Committee meeting of Wednesday, March 13th to order. First item is Pledge of Allegiance. Please rise. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Next item is a motion to adopt the agenda.
Romano adopts the agenda.
I have a motion by Commissioner Romano, supported by Commissioner Nard to adopt the agenda. Any questions on the agenda? Seeing none, please vote.
Motion passes 12-0.
Thank you. Next item is public participation. This is the first opportunity for public participation is for those who wish to speak for a maximum of 3 minutes on today's agenda. There will be a second hearing of the public to discuss any issue relating to the county at the end of the meeting. Anyone from the public wish to be heard? Those that are on the agenda for the appointment interviews will be called up individually. Going once, twice, done. Next item is item 5A, Community Mental Health Services Board. Board appointment for vacancy, 3-year terms, April 1st, 2024 through March 31st, 2027. First one, I believe in attendance, is Donna.
Good afternoon. My name is Donna Cangemi. I will just be giving you highlights of what I have on my application this morning. You can certainly read the long application that I submitted. I'm a licensed master social worker for over 30 years. I will give you my experience that I've had in the field. I worked at the Macomb Intermediate School District, at Neil Reed High School and Rockwell Junior High School, at Children's Hospital of Detroit in the head trauma unit and the intensive care unit as a social worker. I worked through the Macomb County Office of Substance Abuse in Anchor Bay, Armada School Districts, and Romeo School Districts, working with substance abuse adolescents. And then I came here to Macomb County Community Mental Health, and I worked at First Resources and Treatment Southeast for 24 years as a therapist, and I loved it. I'm knowledgeable in the mental health code, federal regulations, as well as the policies of Macomb County Community Mental Health, and the Recipient Rights Manual. I participate in mental health trainings and seminars to keep up to date to deliver the best services to our consumers. I have attended all full board and subcommittee meetings. I did miss a few meetings because I had COVID and I had major surgery last June, and I did have to miss a few meetings then. In addition, I volunteer at Turning Point in the Personal Protection Office, assisting the public with writing and submitting domestic and non-domestic PPOs. I'm also on the advisory board for Crossroads Clubhouse. Crossroads Clubhouse is a CMH program that supports adults with mental illness and assists in developing social skills and improving daily functioning through activities with the support of peers and clubhouse staff. It really is an overwhelmingly wonderful program. I am just really honored to be on that board. On a personal note, I have a brother that's receiving services through CMH, and I have 2 grandsons, one that has autism and another brother that has Asperger's syndrome. In closing, I would like to say thank you to the board for the past 3 years of serving. It has been very rewarding, and I have loved serving under Phil as the chair. We have a supportive and cohesive board. I am hopeful to continue. Thank you for the time this afternoon.
Thank you, Donna, and thank you for all you've done in the past.
Thank you.
I would mention, please try to limit your remarks to 3 minutes. You did fine.
Thank you.
Next is Lee Friedman. I've received a call from Pastor Friedman. His wife is currently ill and will not be here. Next is James Gammicchia. He's unable to attend. Next is Sherita Harvey. And while Sherita's walking up, I will mention the nominations will be voted on the full board meeting February 21st. It's all yours. Thank you.
February.
Hi,
February.
February.
Well, I want to go back. Okay, we'll take March.
Good afternoon, everybody. My name is Sherita Harvey. I am the president of Lifeline Center. We are a private practice in Macomb County. We do outpatient behavioral health, which we service adults for mental health and substance abuse. My experience includes I worked at Harbor Oaks Hospital for about 13 years. And with that time there, I was able to experience working in multiple departments, including the intake department, utilization review department, partial day program for both adults and children, as well as the intensive outpatient program. I have a certification in substance use, and my work includes just providing mental health services, trying to get people to see outside their normal lifestyle and try to be better for our community as well as for the society. I would like to bring to the table my experience in being able to conduct intakes, whether they are for mental health or substance use. I have helped people regain their driver's license through substance use treatment, as well as work with courts to be able to be an alternative to prison or jail. I am currently in the process of working with a court, God bless you, to be a part of their drug court program. So we will be providing alternatives to prison or jail, trying to help people become better persons, not just have a clean record. So I would love to be a part of this board to provide multiple services and to gain more experience as well. So thank you guys for listening, and I hope to work with you all soon.
Thank you. Thank you.
Thank you.
Thank you for your service.
Thank you.
Next is Constance Jones.
Hello, good afternoon. My name is Constance Jones. I am not going to bother telling you my experience because I do believe that the board members that are currently a part of the Community Mental Health Board will be reappointed. But I do think it's important that I tell you what my goals would be if I were selected, because I think everyone should hear this. Firstly, to increase access to community mental health services to anyone in Macomb County that is in need. The National Alliance on Mental Health has reported that more than half of Michiganders did not receive the mental health services that they needed in 2021. I know that Macomb County Community Mental Health is making great efforts and has made some accomplishments in increasing access, and but I think that is also an area that needs to continue to be worked on. Hiring and retaining qualified CMH staff and providers that are trained in evidence-based practices. I used to work for community mental health. I have not been involved with community mental health in a few years, but in preparation for this, I did some research, and it does appear that a lot of the staff are leaving, and I don't know what the reason for that is. And there is a lot of, there are some innovative treatments. There are things that can be done. I don't know what you guys are doing to retain and hire qualified staff and providers, but the services that community mental health provides will only be as good as the doctors, the clinicians, and the staff that provide them. If I were a member, I would try and access all the funding that's available. Apparently our governor and legislature are making funds available. There are grants available. So I hope that the board will try to access as much funding as possible. or that's available. And then lastly, I would continue to work to ensure that Macomb County Community Mental Health remains the organization that manages the Medicaid mental health, developmental disabilities, and substance use disorder services in Macomb County under contract with the state of Michigan. I don't know if this is old news. I don't know if this is something that everyone is comfortable with at this point, but as an outsider now looking in, community mental health, I'm actually surprised that you guys are still around. And there are corporations, large corporations, hospital systems. There are so many other entities that can come in and take over so easily. So that would always be on my radar. And that's all I have to say. Thank you for your time.
Thank you. Next is Mark Kilgore.
Oh, good afternoon, everyone. I figured I would just come up and speak from the heart, because that's where my passion comes from. I've been on the board for 3 years. I've learned a tremendous amount, and I still have a lot to learn. It's a complicated system. I'm learning a lot, and I'm very pleased with the direction in which CMH is going right now. There's a lot of things in the works that are going to benefit the residents here in Macomb County, mental health and substance use disorders. I've been working for a CMH provider for about 12 years, and I'm also involved with a lot of different groups in Macomb County, sexual assault response team, police community for equality, several neighborhood watch groups. I've been able to distribute over 7,000 Narcan kits to the community and save numerous lives with those. And I've always had a passion to give a voice for people that feel they're not being heard or don't have a voice. And that's really where my focus is help to give a voice to those that feel they're not heard. So I'm just happy to be here today, and I hope you consider me for a reappointment to the board. Thank you.
Thank you, Mark. Next is Chairperson Phil Kraft.
Want me to go down there?
No.
Yes, I think you should.
We can vote on that? Thank you, Mr. Chair. I will keep my comments brief. As many of you know my background and everything that I'm involved in. But I have been on the Community Mental Health Board now for, 7 years. About 4 months after I became a commissioner, I was appointed to that board, and I've been serving on that board ever since. I've been program and budget chair, I've been vice chair, and as of recently, I say recently, it's been 3 years, but sometimes it feels like 1, other times it feels like 10. I have the privilege of being the board chair. And from when I started on this board to where we are now is night and day. It's completely different. When I started, we had folks lined up, family members, friends, all coming to us crying because we didn't have money when we were cutting services left and right. And we had to cut those services because we didn't have the funding from the federal and the state government. And ever since that point, and me walking into those meetings going, what am I doing here? What did I get myself into? We've really turned the tide. And it all started with changing up our leadership team. We brought in a new CEO. We brought in a CFO. And all of those steps led to where we are now, which is a fairly successful organization. I would say even more so than fairly, but we have our challenges. Constance rattled off a few of them. Those are things that make me lose sleep every day. So Constance, you're spot on there. Access, that's one of our main goals in our strategic plan, is to increase access for the folks in Macomb so that everybody that needs services can receive them. Staff, we're in a staffing crisis all across the county, all across the state, all across the country. It's not just here. We're looking for help. We need help, and we need qualified help. And I know the state and the feds are working on ways to do that. I was listening to some committee hearings today in Lansing that were talking about how to fuel that pipeline to help us do our job. And our job is to care for those that need that care, the people we serve. That's why we're there. And that's my focus. My cousin has had a mental disability since before I was born. She's in her 60s. She's had it her whole life. And so, my family has been surrounded with that. And that's kind of what propelled me to get into this to begin with. And I've learned so much. And like Mark said, Mark's only been around for 3 years. I've been around for 7, and I'm still learning stuff. There's so much that I don't know, but I'm willing to learn. And our board is fantastic. We have a great team. Our leadership team is great, led by our interim CEO, Tracy, who's here in the audience. She's been chief of staff. She's been COO. She's been pretty much everything under the sun. And right now, one of our main challenges is finding that permanent CEO. Tracy's been doing a fantastic job so far filling in that role, but we're going through that process right now, which is another thing that weighs heavily on me as well, because we need to find the right person. And that's going to be a challenge. We were lucky with Dave, we're lucky with Tracy. So that's one of my biggest things to do now, is to find the correct CEO. And I have a fantastic board to help me do that with. And I look forward to serving for another 3 years if you all appoint me. Thank you, Mr. Chair.
On behalf of all of us, Phil, thank you for your leadership and your chairmanship for the last 3 years and the 7 years you have done this. Next is Stephanie Lange.
I brought my timer. I'm not going to go over on you. So I'm Stephanie Lange. I'm a social worker. I've been in Macomb County my whole life. And I worked at the community mental health for 15 years. I started in the Don Habkirk days, if anybody was around then. And I just left a couple of years ago. But I was in charge of managing the block grant dollars that we received and helping to, figure out where we could put some of those dollars to support the people that were being served in the county. And I had no intention ever to apply to be on the community mental health board. And I was minding my own business. And I got this email that said, hey, there's 4 vacancies. So I know you have a lot of fabulously talented people that are coming forward. I guess the only thing that I could say that I might be bringing to the table that's a little bit different is I have the substance abuse background, was starting my career in the 1990s at Care of Southeastern Michigan, and also working at Dakota High School for the last 25 years with our youth here in the county. So I've worked with adults and youth with mental health and also with substance use disorders and recovery. And I'm also a person in long-term recovery. So those are some things that might be unique or different or things that you're looking for, but I don't think you have a lack of qualified folks coming forward. I just excited to be considered and to be given this time to talk to you, and we'll see what happens.
Thank you, Stephanie.
That's the spirit.
Next is Marianne Lyons. Is she in attendance? No? Okay. Next is Lori Phillips.
Hi, everyone. My name is Lori Phillips. I am retired from the Macomb Intermediate School District. I am the mother of a 37-year-old son with developmental disabilities who has been receiving services for 30 years, over 30 years. I have served on the Macomb County Community Mental Health Board for 6 years now. Presently, I have the position of Secretary Treasurer. I chair the Recipient Rights Committee and the Nomination Committee. I sit on the Person Served Advisory Group with the Community Mental Health Association of Michigan. I have volunteered at many of the health and wellness affairs that have been going on through Macomb County over the last couple of years. Over the last 6 years, there have been many changes. One that I have noticed is the collaboration between our agencies and you guys. Such a difference of support, talking, and things. Just to reach out to everybody in Macomb County. As Macomb County Community Mental Health continues to change, move forward, and expand, I will continue my commitment to serve, learn, and grow. I am asking for your support to continue serving on the Macomb County Community Mental Health Board for another 3 years. And for that, I thank you.
Thank you. Last but not least, Angel Weiss.
Hello. Please excuse me if I'm nervous. This is the first time in front of all of you.
No need to be nervous.
Sorry. I was diagnosed with mental illness in 1990. I didn't find Crossroads Clubhouse until 2019. Since being at Crossroads Clubhouse, I have been a member as well as participating in the foundation board and the advisory board for Crossroads. I have done other volunteer work, such as I was on the MISD Parents Advisory Council, and I was also on the Macomb St. Clair Autism Society Board when they were around. I have a unique view of the Community Mental Health Board. I have a unique view of the community health system. Not only am I a member who receives services, I have children who receive services, and my brother receives services who I take care of. I have been participating in the last several board meetings. I have been coming diligently, trying to make sure that I know what I'm doing. Don't think I have a clue. I believe very strongly that the board needs somebody who receives services on the board. It gives them a unique perspective as well as a good vote and a good voice. That's all I have for you.
Thank you, Angel. I need a motion to refer all the appointments to the March 21st full board meeting.
So moved by Nard.
Support.
I have a motion by Commissioner Nard, supported by Commissioner Van Sickle. Any discussion? Seeing none, please vote.
I need votes from Commissioners Haw, Perna, and Sabatini. If you'd like to voice vote, I'll add it in.
Yes.
Yes.
Thank you. Motion passes 13-0.
Next item on the agenda is correspondence. I need a motion to receive and file.
So moved by Nard. Support.
I have a motion by Commissioner Nard, supported by Commissioner Grott. I will speak to this correspondence. This is the retirement board review update. Somewhere in the charter, I believe Crystal found that we need to give an annual update. So this is it. I have updated you periodically throughout the year. So as the board's designee on the Mercer's retirement board, chair of the Retiree Healthcare Fund, and commissioner representative on the intermediate retirees medical benefits, I want to take this opportunity to provide you a short update on all three. You have the correspondence in there, so I'll just touch on the highlights. The board performed well in 2023, returning 17.56% interest on our assets that have been priced as of December 31st. Many of the private equity, private real estate, and private debt strategies have not priced as of yet, which is a common thing in the retirement industry, but we expect that amount could go higher. Any of you got 17.56% on your personal investments, come talk to me. I'd like to know how you did it. The fund as a whole continues to outperform its public fund peers, both near and long term. We are currently in the top 1% of the country. Both the IRMBT board and the RHC, we have performed similarly to the ERS board, with likely higher returns for the year, since there is still less allocation in the private classes. Currently, all three remain in compliance with investment policy statements and Public Act 314. We get audited for this every year. Our current balance in the employee retiree system is $1.1 million. That is currently chaired by Mark Delden. The Retiree Healthcare Fund is $1.1 billion. Thank you for that correction. The Retiree Healthcare Fund has $487 million. That is chaired by myself and with Commissioner Sabatini on the board with me. And the Intermediate Board is $268 million. That is chaired by our chairman, Don Brown, for a total of $1.88 billion in the healthcare fund. We meet twice a month, go through almost all of the investments. I believe currently we have 57 different money managers. Our gain for 2023 was $171,400,000 $464 in interest payments on our investments. So that's a brief report. I'd be happy to answer any questions that anyone may have.
Would you take care of my investments too? With that return, I'd like you to take care of mine also.
My-
Tremendous job. That's all I have to say, Mr. Hall.
Thanks, Commissioner Romano. I'd like mine to be that as well.
Chair,
Seeing
if I-
no speakers,
Can I just say something real quick?
Commissioner Sabatini.
I just want to acknowledge you, Chair. Being on all three of these boards, this takes a lot of time, Commissioners. You may not realize it, but Harold's in so many meetings. They are long meetings, many of them, and obviously, the correspondence speaks for itself. We've done a great job for our employees, for our retirees, and it's kudos to everyone that's involved. So, thank you, Chair.
Thank you, Joe. Commissioner Brown.
Thank you. Before just as we were becoming a county executive form of government, the board transitioned into a new system to fund retiree health care. And we set up that retiree health care trust to be able to, we put money in it, and we've since earned so much returns on that money that we haven't had it hit our principal. We've been paying for our health care costs out of that fund without having to hit principal. It's truly been a wonderful experience it surpassed, quite frankly, our expectations when we set it up. We figured some years we would, lose and some years we would gain, but as it's turned out, we've been able to pay off our retiree health care and our current costs without touching our principal. It's remarkable, and that's due to the returns and the investment professionals and the current board and the previous boards before them, years before. It's been diligence over the decades that have invested this money responsibly, so that we don't have to end up in a situation, as other communities have, where they have to go back to the taxpayers of the state of Michigan to try to bail them out and increase costs and cut benefits to their employees who retired thinking they had a guarantee, and they didn't. Our retirees can rest assured, and the taxpayers rest assured, that what they've got will stay, and they won't have to come back for more. So, congratulations, Mr. Chairman, on the extensive work you do, as Commissioner Sabatini said. It does take a lot of time, and there's a lot of information. It's a lot of responsibility. People sometimes forget that the Board of Commissioners, we manage a budget that's over $1 billion, but we are all fiduciaries to nearly $2 billion of money that belongs to the retirees, past and current employees, that we're entrusted to maintain. And it's not something somebody should, we deal with every day, and we don't really appreciate it, but we should. And it's something another reason why we can brag about the state of this county. We not only are solid financially on our books in terms of maintaining services and quality services and taking care of our employees, but we've got this retiree fund that we've well managed for many decades, and the future looks bright. 17% in this tough market is remarkable. And being the top 1% of all publicly traded funds in the country, we're in rare air there. So it's, again, it's something to be proud of, and we often don't talk about it enough. We've actually done more in the last few years since you've been chair of the committee and you've been bringing those reports forward, and it's good to point that out from time to time. So thank you, Mr. Chair.
Thank you. Well, I can say it's an honor and a privilege to represent the board. When Don became chairman, we had the discussion about transparency between the three boards. It's the first time in the history of Macomb County one commissioner has sat on all three. So you know exactly what's going on from one to the other, and they're not always the same. There's different investments, different strategies, and with Don chairing one, and I can't tell you how much I appreciate Joe there being our finance chair, because he sure asks the right questions, and it's been an honor and a privilege. So with that, no further questions, please vote. To file.
I'm missing quite a few,
Yes.
actually. Thank you. I'm missing votes. The system is running really slow. Commissioners Haw, Lucido,
Yes.
Yes.
thank you. Perna,
Yes.
Sabatini, Van Sickle,
Yes.
Song. Thank you. Motion passes 13-0.
Thank you. There it is. Next item is proclamation. This is a full board approval request for a proclamation congratulating the Eisenhower High School dance team for placing in the national championship. The reason that we're approving it tonight is so that it can be presented this week. So I need a motion and a support.
Motion to support.
Support.
Motion by Commissioner Gratz, supported by Commissioner Van Sickle. Commissioner Gratz, would you like to speak to this?
I'm requesting full board approval today because the event is tomorrow. I'm not able to get all the 42 dancers next week. They have their banquet tomorrow, so I will personally deliver. Thank
Thank
you
you.
so much for the consideration.
Thank you for doing that.
Thank you, Mr. Chair.
Seeing no questions, please vote.
What?
Adriana, next time you sit over here. Oh, now we got three things. How'd you know I was voting yes?
Motion passes 13-0.
Thank you.
Thank you. Next item is a proclamation commending Aiden William Turner for achieving the status of Eagle Scout in the Boy Scout of America. Need a motion, please?
Support, Lucido.
Motion by Commissioner Sabatini, supported by Commissioner Lucido. Commissioner Perna or Romano, would you like to speak to this?
No.
No. Commissioner Romano?
No, we're fine.
Fine. Seeing no discussion, please vote. I vote yes.
Thank you.
I vote yes also.
So I'm just missing a few again. Chair Brown, oh, now it's all came up. Motion passes 13-0. Thank you.
Okay, since we've got this system fixed, it is my honor to turn the gavel over to Health and Human Services Committee.
Thank you, Vice Chair Brown, Haw. We'll start out with approval of the minutes. Can I get a motion to approve the minutes?
So moved.
Support Perna.
Motion by Haw, support by Perna. Please vote.
Hello.
Here we go.
It was molasses in January, only our January's been warm.
Can we get a voice vote? Any, all in favor?
Aye.
Any opposed? Motion passes. All right, now we'll move on to Health and Human Service Committee Department recommendations. Start out with item A, which is a purchase from Motor City Electric Technologies, key scan access control, door readers, and related equipment in the amount of $86,000. And we have Director Sandy here. How are you?
Good
Oh,
afternoon,
yeah, can we get a
Commissioners.
motion to recommend a full
So
board?
moved.
Support.
Motion by Haas, support by Nerd. Thank you. Hi, how are you today?
No, there were no minutes.
Hi, Commissioners. How are you doing today?
Good.
It's a beautiful day out there.
There were no minutes.
What I have in front of you is a request to approve the purchase of our badge key scan access control readers. There has been an effort to secure our facilities and our locations rather than using a key system where keys get duplicated and they get lost. This badge scanning access system is much more reliable and provides functionality for us, which we all are in agreement that employee safety and the safety of all of our residents is at the at priority and up front. So what I'm asking for is the approval of $86,925,000 to install key scan access at several of our locations, including Mount Clemens, Southeast, and also our Verculen location as well. The great thing about these systems is that we can repurpose. So if there's any changes in building in the future, if we build out, we can repurpose this equipment. It doesn't go to waste, which is one of the reasons why we're also looking at investing in this technology. And also that these are grant dollars that our great health team went after in our emergency preparedness program to secure the funding to do this. So this is grant dollars. Be happy to answer any questions that you might have. Thank you.
Thank you. Do any Commissioner Van Sickle?
Thank you. Good afternoon, Andrew.
Good afternoon.
Emergency services, how are they handled?
Emergency in terms of public health or?
Like if the fire department shows up to the building to get in, how is that handled?
Yeah, it's a great question. We are able to program these, so often public access doors are open during accessible hours. So the first responders have access to it. They also have on our doors knock boxes, they call them, where they actually have keys where they can get into the doors and override the system itself.
Okay. Yeah, I'm not so much worried about public access hours, but like the middle of the night, if
Absolutely.
there's a fire or something and they need to get in.
Yeah, first responders
So the
can.
keys.
Right, absolutely. Our fire department has access and they can get in the building if need be.
Okay, good. Thank you. Thank you, Chair.
Commissioner Perna?
A question, I don't know if you can answer this. On the key scan that you're asking for, we have several departments in the county. Does each department have a different program, or are we all unique and everybody has the same key scan program?
One of the reasons why we're going with Motor City Electric is that they're the vendor for the county. So it's the same vendor, same system, whether it's this building or our health department buildings, it's the same system to be consistent across the board so that we don't have 5 different systems. They are the same system.
So other departments, be it water or prosecutors, county exec, everybody has the same system or will have
Correct. It's the same software, it's the same system, it's the same vendor, Motor City Electric, that installs these.
All right, thank you.
You're welcome.
Commissioner? Any other questions? Seeing none, please vote.
Motion passes 13-0.
Moving on to item B, a budget amendment for the Health Department Grant Fund, MDHHS Comprehensive Planning, Budgeting, and Contracting, LHD, Grant Amendment Number 2, in the amount of $2,139,596. Can I get a motion to recommend to full board?
So moved by Nard.
Support Zinner.
Motion by Nard, support by Zinner. All right.
Thanks,
All right.
Commissioner. Yeah, another great news item that we are actually seeing for the first time some ground and movement of cost sharing between the local health department and the state health department in terms of revenue sharing that comes to the local health departments and essential local public health funds. We were finally successful after years of going to the state and saying we are administering and we are doing services for our health department that we are not appropriately funded for. They heard us and they actually gave us quite a substantial increase to our grant dollars that came through this year. This is not one-time funding. This is going to be ongoing expected funding year after year. So with that, we have the opportunity of drastically changing some of our services to help them out. Some of those services that we've talked about in the past are those services like our immunization waiver program, additional help. We saw the highest number of waivers. Commissioner Zinner, I think you'll be very happy to hear that the plan with this is one of those things is to have a public health nurse that will help us get through that list of individuals that have waivers so we can really get through that. We saw a 13-year high with that number for the first time ever. We exceeded over 3,000 appointments through that waiver program. So we see that we need to shift resources to that program. That is not the only thing that we're able to do. We're going to add water quality services. We all know how important our waterways and our systems, our tributary systems through the work with Public Works. We do monthly sampling. We can now increase the sampling if we have additional staff to do the sampling. So part of this would be to bring on environmentalists, not only in the water quality arena for our environmental health program, but also our food program, to accompany those requests from our restaurants and our food program to help get through those licenses faster and get those businesses up and running more quickly. Sometimes calls that you receive personally about trying to help and assist navigate to help get those restaurants open as soon as possible. With these dollars, we can bring on additional staff to help us get that quicker and more effectively and efficiently. We're also looking at helping out our hearing and vision program. This is a required program through the state that we work with our schools. We have technicians that go out to the schools and do hearing and vision screenings. That program has been challenged because it's always been part-time. What we'd like to do is have a full-time technician that helps with those part-time individuals and make sure that we continue to offer the best service possible for our hearing and vision program. Another program near and dear to my heart is Children's Special Health Care Services. In October of 2023, there was legislation passed where now families, it increased the eligibility from 21 years of age to 26 years of age. So we're expecting a 20 to 30% increase as a result of that eligibility. So we're looking to add staff to help our families. This is a great program. If you've ever utilized our Children's Special Health Care Services, these are families that need us the most. And it's a great program that we're very proud of, and we want to add to that. We're also looking to make additions in our medical examiner's office. In January of this year of 2024, there was legislation passed for creating an overdose fatality review team. This is something that a review team would be out of the medical examiner's office working with outside partners, FAN, CARE of Southeast Michigan, to work with them on looking at these specific cases and new case review for overdose fatalities. It's a lot of work to do this because you have to mine the data, bring the cases, review the cases, and then now set up the meeting and do that. So that is a significant workload that with that legislation, unfortunately, there's no funding attached to it. So this is an opportunity that we can use these grant dollars to help support that in the medical examiner's office. We also would like to really be the forefront of technology. Informatics and nursing informatics is one of the most up and coming fields. It's already here. When we talk about Qualtrics and utilizing Qualtrics, which we're doing, that informatics teams are the ones that are utilizing in that Qualtrics system. We just have one person right now. We need to give them help and support. We are now looking this year at getting a better electronic health record. These additional staff people are going to help with that and facilitate a better system for us that communicates hopefully with our outside providers and our outside healthcare system, but more importantly, provide a better response and a better experience for the residents coming to our clinics that need our services. That system is going to allow that person to get a better experience that they might not otherwise get with our older system. But we need the staff to do that. We need the staff to help build that, to test that system, to help us fix and utilize the great technology that you've given us in the past, things like Qualtrics, continue to use that the best we can. And we are utilizing that. Very proud of that fact that we are utilizing that system that we came to you in front of you during COVID. As you can tell, I'm very excited about this opportunity. We don't get this chance. It's usually once in a lifetime. So we're very excited about this opportunity for these grant-funded positions. Thank you.
Thank you. Anyone have any questions? Commissioner Sabatini.
Commissioner Zinner's first.
Oh, Commissioner Zinner. Commissioner Zinner.
Thank you, Chair. Thank you, Andrew.
Thank you, Commissioner.
Commissioner Sabatini.
Thank you, Chair. Andrew, great news. My only question is in regards to the $1.4 million that you're going to be receiving from the state relative to this. Obviously, we probably didn't budget for that surplus. This is, like you said, a one-time scenario, but hopefully it will continue going forward. In your department right now, based on employee counts, how many vacancies do you have currently?
Good question, Commissioner. Get that number. I don't want to give you an inaccurate number, so we can get that to you. I don't know offhand.
Okay. Obviously, this is for additional 13 FTEs. Are you looking to possibly fill some of these positions on a part-time basis rather than a full-time, or are you looking only for full-time?
The work necessitates a full-time position, so we're looking for full-time positions.
Okay, great. Thank you. Thank you, Chair.
Thank you. Commissioner Van Sickle.
Thank you, Chair. Good afternoon, Andrew.
Good afternoon.
When the grant runs out, what do you do with the people?
Joe, it's a really important question. We have been told by the state that this is going to be ongoing funding, that it will continue not just this year, but years after. Once the funding is reduced, we will have to make decisions on cutting positions and looking at those positions, because if the positions are funded by these grant dollars and the grants go away, then we have to make sure that those, unfortunately, the staff, we no longer are able to support those staff.
Yeah, I don't want to bring in a whole bunch of people and have to just let them go.
I don't either. And so we make this decision very carefully with making sure that it's not just one-time funding, that this is indeed, we've been told, and we have it in writing from the state, that this is going to be ongoing funding. So that's why we feel comfortable with going forward with the positions.
Will any of your current staff maybe transfer into some of these positions?
If there's promotion opportunities, there might be some staff that go into these new positions that are created. Obviously, we would then have to post their positions once they're vacated as well.
Okay, thank you. Thank you, Chair.
Commissioner Brown.
Thank you. Good news, real good news. Will you be able to expand the health outreach programs? One time this county had health readouts reach the senior districts in every one of the commissioners' districts. I'd like to see us get back to that. Is there some way that we could, those are full-blown programs at the time. Is there some way we can get back to that? We've got, additional staff here to help with that.
Absolutely. One of those things that we've really looked at, and I hope that you see presence by our health department staff, specifically in healthy communities, is probably what you're referring to, Commissioner. We want to be out in the community, no doubt. And I think we've done events. We've been requested to be at health fairs and do different events, and some even years that you're sponsored. And we happily will be out there and support that. So if you have events or you have ideas or have outreach that you would like us to be there and present, absolutely, we want to do it.
Well, I'd like to, as an example of what could be possible, I'd like to have a health fair at the Plaza Grande Center in Shelby that services the region up there in that part of the county. Just like down at Warren, there's a hall down in Warren that we could use, to have them centrally located and have where the commissioner sponsors and helps promote it, as well as have the county in there to help, support the mission.
Would be happy to support that, Commissioner. So, if we want to work together, we get in contact with me, and I think we can definitely look at that.
We'll work on that, and we'll see where it goes.
Okay, sounds great, Commissioner.
I appreciate that. Thank you. Thank you, Madam Chairwoman.
Thank you. Commissioner Kraft.
Thank you, Madam Chair. Andrew, congratulations. I can see and feel the excitement coming from you. It's great. I have a technical question on the contract. On the signature line on page 3, it has Christine from the Bureau of Purchasing, but for Macomb County, it lists Vicki Wilbur. Would she be the correct signer, or is that something that would need to be changed?
No, that's outdated on there, and they've been We've
little
told them
behind?
numerous times.
The state's a little behind? Stop it.
You know, Vicky's still working with us in present, but that is not the correct signatory.
Okay, I just wanted to make sure that was pointed out.
Yep.
Thank you, Andrew.
Thanks.
Congrats
Thanks,
again.
Commissioner.
Thank you,
Thank
Madam
you.
Chair.
Thank you. Well, congratulations. I'm really excited for all the great things, and I know that the extra staff is definitely needed over in your office, so I am excited that hopefully you can get those positions filled and we can move forward with speeding up everyone's wait times when they call.
Yeah, absolutely.
And getting
Thank
them
you,
the
Commissioner.
assistance that they need, so thank you very much. Can we see no more speakers? Can we please vote?
Oh, did we get the vote already? Zinner, yes. I did not mess up.
Commissioners Wallace and Ha, I'm missing your vote.
Personally written.
Motion passes 13-0.
Thank you.
Thank you very much.
Thank you.
Now we'll move on to item C, a budget amendment for Macomb Community Action, Weatherization deferral in the amount of $1,264,220. And we have the Director of Macomb Community Action, Director Scott is here. How are you today?
I'm good.
Oh, yeah, can I
Madam
get a
Chair.
motion to move to full board?
So moved by Nard. Support Zinner.
The motion by Nard, supported by Center. Thank you. Okay.
All right, good afternoon, Commissioners. Thank you for your time today. The item that you have before you is funding from MDHHS in the amount of $1.264 million, which is an increase in the allocation to our Weatherization Deferral Fund. For some context, we have a Weatherization Fund whereby individuals who are in need can come to us and make application to our Weatherization program. So they can get their homes insulated, they can get new windows, they can have seals checked and replaced if they are low income and they qualify for the program. What sometimes happens, though, is there's some major structural issue with the home. Perhaps there's a need for a new roof, perhaps there's a foundation issue or a wood rot issue. And in those cases, historically, we have deferred the project, given the consumer 30 days to get it remedied, and then we could come back and go ahead and do the weatherization. Or if they're not able to remedy it in 30 days, then we have to defer the project indefinitely until that issue is fixed. These deferral dollars allow us to fix that structural issue. So we can replace that roof before going in and finishing the weatherization project. We can fix that foundation issue. And so the state has seen fit to grant us an increase to our allocation, and it's the $1.264 million.
All right, thank you. I do have one quick question. So is this also going to be something you think you're going to be getting every year now, like receiving regularly?
I cannot speak to the amount that we
Okay.
will receive year over year. Our allocation is typically based on the previous year's spending.
Okay.
But this is a grant that I anticipate us
I mean, I think
receiving
it's great
year over
because if
year.
someone can't afford their windows, a lot of times they can't afford the structural issues.
Exactly,
So I think it's
exactly.
fantastic. Commissioner Nard.
Hi.
Hey.
I get a lot of calls about the residents in Warren, and as you know, the infrastructure there is kind of aging. So most likely, if you're dealing with people that are low income, you know, and they need to do any structural work, that's going to be you. They already low income.
Absolutely.
So, and I noticed that a lot of the people, maybe out of 10, maybe 2, only get selected to get that done. Is there, and then you want to find out people that even know about the program. So what are you guys going to do to make sure that the people on the south side of this, of the county, know about these types of programs? And what do you do when they do need, you know, other work done? Because I just have to be honest, they're not getting anything there really, getting things done. So we need to change that real fast.
Yeah, I agree with you. And I mean, I guess this is somewhat off topic, but one of the things that I've really tried to delve into since I got here is what does our outreach look like? Who are we missing? What communities are getting bypassed? We have a strategic plan in place now that we worked on pretty much the last 6 months of last year, with major components with regard to our outreach, our better connections with external partners. As we kind of go into the implementation phase of that, you know, throughout the course of this year, my hope is to be connecting with all of you frankly, to get into your communities, to find ways to better reach people. I know Commissioner Wallace and I had a discussion about an event in Mount Clemens. I happened to be out of town for that, so I hope everything went off smoothly with getting materials. Okay. But yeah, we are wide open to ideas for promoting ourselves and the programs and services that we offer. We have some ideas of our own that we plan to implement as well, and much of that includes connecting with you all.
Okay, because I know you mentioned, Commissioner Wallace, but she's still north of the county, so
Agreed.
you need to probably get in touch with me so that we can get something going there, because those people need help. And some of, a lot of them are working people. That's the problem I'm seeing too, is when you say low income, you have working people that need help. I mean, they work, and by the time they pay for gas and stand in one of those lines and get some food, they still need help with getting their windows fixed. And so what are we gonna do about those people? I mean, we're helping low income, but we have people, what about the folks in between that? Between low income and middle class? Those people are being missed, and we have a lot of people like that there that need help, and they call me constantly. So I just want to be able to give them something, when they ask. So.
Yeah, I appreciate that. That's an issue that we are also wrestling with that I don't have an answer for today.
Okay.
Our programs are bound by federal poverty guidelines, and we do run into quite a few people who come to us. They need our services. There's an acronym for it that I can't remember. It's asset limited employed. I can't remember the acronym, but people who are working, who do have an income, but it's maybe not enough to cover those necessities, to cover that major home repair. And we do not always have resources that can speak to them because of the federal guidelines that we have to abide within. We do have, so actually the next item, in a small way, I'm able to address some of that. But in a large scale, I do not yet have an answer for those folks who slip through the cracks.
Okay, well, going forward, if you could get in touch with me, I'd like to get together with you and our state rep, Donovan McKinney. Maybe we can get him to kind of change something there. I mean, we need to help those people on the south end of the county.
Agreed.
So, it'd be great. Thank you.
Thank you.
Yep.
Commissioner Wallace.
Thank you. Thank you, Ed, for everything that you've brought to us. I'll be real quick. One, us as commissioners, I feel like the other department heads are so open for us to call or email and give ideas, and they get back very quickly. So, I'm speaking for them, so forgive me, but don't hesitate to reach out to them with ideas or what your community may need, because if we have an idea, they're usually there to say yes, or this is how we can get it done. And they have helped me many, many times. So I'm sure they'll do the same for you. I feel like there are a lot of people that are like what you said, just on that border. And that's from housing to utilities, that they're just not able to get that help because they're just over by, very little. So I would love to see, I'm sure you said you're going to talk something about that on your next agenda item. So I'm excited about that. But all of us can relate to that. We all have people in our communities that are right there. So how are you letting people know about these different programs? I know for me, there's someone in your office that is also in my community, and she's like almost our outreach person. She's always telling us about what you guys have, the programs, and as soon as she posts, there's like a bunch of people that reshare. So I feel like we are always in the know, but that's not for every community. So how are you marketing these programs?
Well, right now, we do utilize some social media. It's limited. There's a Facebook page. I would like to see us expand that. I hope to see us expand that in the coming year. We have, any number of brochures and trinkets and giveaways, and we show up to things like senior health fairs. Any large event that someone might be putting on, we're happy to man a table there. There was an MLK breakfast last month, we had a table there. And we're open to those kinds of things. At the moment, that is kind of the extent. If people are already engaged in certain of our programs, we make every effort to tie them to our other programs, to connect them to our other programs. If a family is in Head Start, we make sure that they are aware that this program exists or that we offer transportation or assistance with utilities. I have visions of much broader things, media blitzes and things like that. But I'm not there yet, but I do hope to make some progress with that this year.
Yeah, little steps, I get it. And of course, all of us, again, you see it posted, share it, so your community knows. I think we can definitely partner with you at the very least on that end. So for this program alone, I know you haven't had this much money in the past, but how many families estimated do you think you've helped last year in with this program?
I do not have that number available. Can I get it to you?
Absolutely.
Later on? Okay. I want to make sure I give you an accurate number.
Okay, I appreciate it. Thank you so much.
Thank you, Commissioner. Commissioner Romano.
Thank you, Madam Chair. Good afternoon, Mr. Scott.
Good afternoon.
In a perfect world, Community Action would love to have about $25 million, but it's not a perfect world. Could you and would you send us the federal guidelines for the income limitations for the low incomes? I would certainly appreciate that. So we have some figures in front of us. That's all I have. Thank you, Chairman.
Thank you, Commissioner. Commissioner Zinner.
Thank you, Chair. Okay. No, that's fine. I was waiting for you to finish. You said you have flyers, and I know I've seen several of your flyers. The ones that talk about the weatherization and the different things, could you send some to me and probably to all the commissioners? When you're going to send info, probably send it to our office, and our staff will send it to all of us.
Okay. Yeah.
That'd be great.
Absolutely.
Thank you so much. Thank you, Chair.
Thank you.
Round two, Commissioner Nard.
You said that if someone is already signed up with Head Start, if the families are signed up, that you automatically let them know? Okay, because I got like 5 grandkids that's in Head Start, and their parents didn't know that you had this program.
They weren't aware of these programs?
We had a senior citizens fair today. I didn't see a table or see that you were there to let people know. It was a lot of people. It was at the Warren, the mayor's office, and I didn't see a table there. I mean, I just want, because people are talking to me about this kind of stuff. I guess they saw what was on the agenda, so kind of keep me in the loop, because I like to be able to give an answer when I'm asked, and if nobody communicates with me and tell me anything, I won't know. And I'll tell them I don't know what they're doing over there, so, but I don't want to have to do that. 'Cause I don't allow my kids to say that they don't know. So I don't want to say to anybody I don't know. I want to be informed when something like that is coming, because I have personal, I have kids in those programs, and so, and they're not getting informed about this stuff, so I need to know who I need to talk to so that other kids can know. Because I'll help my kids, but, these other kids are not getting helped. I had one family, they were like $83 over the limit to get the help, $83. So, like Commissioner Romano asked for those, I'd like to see that, because $83, it seems like they could have gotten some kind of help, but they didn't, so.
Yeah, we can absolutely provide that I'll send it to Adriana. We'll make sure everyone gets that. But also, I believe that all of you have, my own personal contact information. If you run into a situation like that, I'll get it to you. If you run into a situation like that, please reach out to me, call our office, and let us know. I have these constituents. They're already connected with this program. They had no idea about this, and then we can address that. And, again, that engagement, that public engagement piece, that's something I need to work on. There's no reason why we shouldn't be in regular communication with entities like the City of Warren, the City of Roseville, City of East Point, because I wasn't even aware of this event that you're speaking of, right? We absolutely should have had a table there.
Okay, yep, thank you, I appreciate that.
Commissioner Brown.
Thank you. The contractors that you use for the weatherization program, are they put out the bid? How are they selected? Because there's a lot of companies in our community that, could do that work, and some of them need the money too. So how do they get into that process, and how are they made aware of it?
I don't have full knowledge of how that bid process works. Again, I'll have to get back to you on that. I do know there is a select number of contractors who typically do the work with us and who have worked with us for a long time.
But hopefully they're going out for bids, or there's an opportunity to compete, or so they can change it up so it's not with the same. So if you'd send me the information, I'd appreciate it. And
Yeah,
when I
absolutely.
get it, commissioners, I'll share it with all of you so that you know. Thank you very much.
Yeah,
Thanks for the good
thank
work
you.
you do.
Thank you.
Your agency does a lot of things. You're the grease. A lot of times it's making a difference for our constituents when they call, and we don't have an option to help find it. And you're often our first call. You're my first call very often to get the help that we need for a variety of things. And I just want to thank you again, and all the people that work for you, because you're a big help to us. We appreciate it.
Much appreciated. Thank you.
Thank you, Chair. All right,
Thank you, Madam Chairwoman.
thank you. Seeing no other speakers, can we please vote?
Sinners, yes.
Mine worked.
Yes. Somebody's stealing our votes, aren't they?
I'm missing about half.
Oh, well, there you go.
Commissioner Grote,
Can we get a voice vote?
Perna.
All those in favor?
Thank you.
Aye.
All those opposed?
No.
That was easy.
Motion passes 13-0.
Thank you. All right, moving on to item D, which is a budget amendment for Macomb Community Action. Huntington Bank, Michigan's Back to Basics grant for $30,000. Can I get a motion to recommend to full board?
So moved by Nard.
Support. Support by Nard, motion by Nard, support by Grott. All right, I'm excited. More
Thank you very
money.
much. More money. We were approached towards the end of the last calendar year with an opportunity to apply for some grant dollars from Huntington Bank. We received what we were told was the maximum, so $30,000. And the plan for those dollars is to use 10,000 of it towards the purchase of food for the food bank. Another 10,000 towards the support of financial literacy outreach efforts. There are some things coming up very soon, like Show Me the Money Day and Money Smart Week, and possibly some other events. So we'll use that to purchase giveaways and do advertisements and things. And then that last $10,000 is actually specifically targeted to the issue we just talked about. So our transportation service that provides transportation to people who need a ride to their doctor's appointments. We're now offering transportation to our food bank to pick up food and go back home. Many of the people who utilize it are also veterans. That is also income constrained. And so we're looking at using that $10,000. The threshold is 200% of the federal poverty guideline, and we get many applicants who are at 210%, 215% of that guideline. That last $10,000 will allow us to go ahead and pay for that ride for those folks who come to us who are just over. And I think, the wider conversation we can have is that a big part of what I'm looking at is we simply need more discretionary funds, more philanthropy dollars, potentially more county investment that doesn't box us into those constraints with the federal poverty guidelines like many of our state and federal grants do.
Thank you. Commissioner Zinner.
Thank you, Chair. And the county purchased some buses a couple of years ago at the end of COVID, I believe. Do you know where those buses are? Are you familiar with those buses? They were kept at the Wirtz building.
So I'm familiar with the fleet of smart transportation buses that we currently own and utilize. Are those the ones you're referring to?
No, they were purchased. Ernest had gotten them. They were supposed to be used for children to take, the buses would take things to meet children in parks, other areas where they could commune with them just after COVID or during COVID.
Okay, so there are two mobile Head Start classrooms. That may be what you're referring to?
Well, I'm sorry. Pardon me?
Mobile Head Start?
Yeah, but I don't think, this was just before Ernest left, we didn't know I didn't know he was leaving, and he said, those buses had never been used, they've never moved, and then something had to be fixed on them, which, of course, I always thought they had started using them. We just hadn't heard about it, really. So as far as I know, the buses have, from our last meeting with Ernest, one of the last meetings, they've never been used, as far as I know. Do we know if they've ever been used? I remember him saying that shortly before he left, that they've never been used. So we have 2 or 3 buses that were specifically made. I mean, I'm just thinking, those could be used for transportation if they're, do we remember these buses?
So we don't currently transport children.
Well, I'm saying,
There are the 2 mobile Head Start classrooms that I mentioned. I'm not familiar with 2 additional buses, though. I would have to look into that and
yeah,
find out.
so like
I'm not aware
whatever
of those.
happened to the buses? Because they were brand new. Maybe you could find where the buses ended up, because they've never been used that I know of. Does anyone here ever know about what happened, those buses?
So the buses I thought were used, and they were for they were never meant for transportation, and that's why they had to be like special because they were meant for educational purposes. So to make them transportation, that's a whole nother job, because they were meant for kids to walk around and for educational purposes, and I thought they were being used for that purpose.
They are currently.
So,
And if it is those same
Okay, then
vehicles we're talking about, those, I think legally cannot be used to transport children, because they're
Right.
large cargo vans. and
Right,
it
I
has to
couldn't,
be a
I couldn't
bus.
remember. I remember seeing them, but I can't remember the whole story on that. Okay, well, that takes care of your transportation, so you've got money for that. And we really need to find those buses, because Ernest had said they were never used. So if you can find them,
Absolutely.
probably still at the Worth's building, I don't know.
I will dig into that and get an inventory of our fleet.
It was before your time there, because you just
Yeah.
came.
I did.
Thank you very much. Thank you, Chair.
Thank you.
Commissioner Brown.
Thank you. Just for everyone's clarification, the numbers change over the time I've been up here. What is 200% poverty? What does it mean in real terms? Of you say someone's 200% of the poverty level. What does that mean in real terms? What's the income number?
I don't have those numbers in
150.
front of me, and it changes based on the number in the household.
Okay.
So like Commissioner Romano requested, I'll find that for you and send it over
Just
to
give
all
us
of you,
a,
but
just send us along a chart, right, so we can
Yeah.
understand what it means when we talk about 100%, 50% of poverty, or 250% of poverty, what it really means on the stroke. Oh, our crack staff's got it here.
able to pull it right up.
We have a great staff.
Let's see,
So when I say 200%, if you're seeing that for a family of 4, poverty level is $40,000, double that.
we'll get us this chart you're gonna provide us,
Yep.
but it's, I don't wanna interpret this properly, so anyway, thank you.
Sure.
Thank you, Chair Brown. All right. Anyone else have any other
The
questions?
staff is crack, I'm not, so I couldn't spit it out to you right away.
Seeing none, can we please vote?
Motion passes 13-0.
Thank you all
Thank you
very much.
Thank you. All right, at this time, we'll move on to public participation. This is an opportunity for the public to participate. To anyone who wishes to speak for a maximum of 3 minutes on any issue. Anyone? Seeing none, we'll close public participation, and we will move on to commissioner comments. Commissioner Kraft.
Thank you, Madam Chair. Real quick, I just want to thank all of the applicants for the CMH board. It's not easy to get up here and speak. Even I was nervous doing it. But I want to thank you all. I'm going to say this every year. We used to not have enough candidates for the slots that we had available. Now we have the other problem. We have so many well-qualified candidates and we don't have enough slots. So if you don't make it, we will try to find other places where you can fit in and help us out or help CMH out as a whole. So thank you so much for applying. Thank you, Madam Chair.
Thank you. Commissioner Van Sickle.
Thank you, Chair. First, along the lines of what Commissioner Kraft said, I was very pleased and impressed with the candidates who applied.
Yes.
So congratulations to all you. On a second note, I noticed something last time we gave out, help me out, proclamations. And we gave out the proclamations and then approved them. I think when it comes to the board giving out proclamations, we should approve them and then give them out. Heaven forbid we wouldn't approve it after we already gave it out. I don't think that would happen, but I think it's just more proper to.
Commissioner Kleinfeld one time.
Oh, yes. Yes.
Saying.
Oh, yes.
So
I understand
This is
procedurally.
for approval, so thank you very much.
Yeah, so.
I will deliver.
So in the future, including our upcoming board meeting, I'd like to see us approve proclamations. I know we did full board approval on that one, but I'd like to see us approve proclamations before we give them out, as opposed to after. I just think it's good form.
Makes sense to me.
Thank you.
That would avoid a problem we've had.
Well, that problem's gone anyways.
It wasn't a problem, it was just a communication issue.
No. All right, seeing no more commissioner comments,
God bless her.
can I get a motion to go into closed session to discuss attorney-client privilege memorandum for independent counsel dated February 15th, 2024?
So moved.
Support, Nerd.
We got motion and support.